Hello, guys. I'm Dr. Helyn Alvarez. I'm a board certified dermatologist here at Westlake Dermatology. And today we're talking about the Accure laser. This is an amazing laser that helps treat acne. And it's really amazing. And I'm excited for you guys to hear about it. I want to let you know that there is a Q&A box available. So if you have questions throughout the presentation, you're welcome to put your question in the Q&A box, and I will answer them at the end of the presentation. And so let's get started. So I wanted to start off by talking about, just in general, a little bit about acne. What causes acne? As we know, acne is a very common skin condition that a lot of people get at some point in their lives. And it is a very common condition that I see in clinic all the time. And acne is caused by many reasons. So we consider this a multifactorial disease. That is not just one reason why you have acne, but usually a few reasons. Some of these can be hormonal changes, family history, genetics, overactive oil glands, clogged pores, bacteria, certain foods such as sugary snacks, and stress. As you see here in the photo, we have a presentation of an acne bump. It's on the skin, you see the little pustule, and it's associated with the follicular unit. And this little gland here is what we call the sebaceous gland, and that plays an important role in acne. Acne is multifactorial, but one of the factors is the sebaceous gland. We get acne in areas where we have sebaceous glands. Sebaceous glands are our oil gland. So when our face feels pretty oily, that's because our sebaceous glands are working. And so this little structure here that looks like grapes, that's our sebaceous glands. And some people have very active sebaceous glands, and this plays an important role. And so this particular laser works on neutralizing the activity of the sebaceous glands. So it works specifically targeting the sebaceous gland. As we know, with acne, there's a lot of treatments that are available out in the market, even when you go see your dermatologist, from over-the-counter products such as benzoyl peroxide and washes. We also have topical medications that we can prescribe in the office. There's antibiotic pills and antibiotic creams, and there's some anti-inflammatory creams and pills that we can also use. There's Accutane, and in the past, there has been some laser energy devices that can help with some of the symptoms of acne. The Accure laser is different. It's a wavelength of 1726. And as you see here, this is actually the laser handpiece. And this particular laser targets specifically and selectively the sebaceous gland. So it's really targeting that oil gland. And because it's very specific for the oil gland, it really doesn't interfere with the rest of the skin. So it preserves the natural skin and just targeting the oil gland. So that's what it's so amazing and can be used on any skin type because it doesn't see color. It is literally just targeting that oil gland. So, what are some of the results that you can expect with this treatment? Usually, we recommend 4 treatments back to back once a month. And after 4 treatments, you can see 70% improvement in your acne. I'll tell you that even after 1 treatment, you can see 29% reduction in 1 treatment. And then as you do more of them, you would get even better and better. Again, this is the machine, this is the laser, and here we have a presentation of a patient that we are gridding. So how does it work? What are you expected when you come in for this laser? It's a in-office laser procedure. If when you come in, we have you come in an hour before your scheduled treatment time for us to clean the face, and then we apply topical numbing to the face. And that topical numbing will sit for about 60 minutes, and that just helps with the laser. The laser itself is going to cause a little bit of heat and discomfort, and so putting that topical numbing cream before your laser treatment will help alleviate some of that discomfort. So After it's been about 60 minutes, we take it off, we wash the face, and then we actually will grid the face. As you see here, this patient, we have gridded, and that's just showing us where we're going to do our treatment. Most people, obviously, we're doing it on the face, but it can be done on other parts where you have acne, like your neck, your chest, and your back. Once we have you all gridded, we're going to put little goggles on you. I'm also going to wear my little goggles as well. And we start the procedure. The machine itself, it first cools the skin for a few seconds and then it delivers heat. And we keep doing that in every little square that we have on the face. Once you're done, which takes about 60 to 90 minutes to finish, your face is going to be a little red, and next day you can really resume same like regular activities. Honestly, some people can even do it that same day. I just tell people next day was probably a little better. So, as we said, it can take about an hour to an hour and a half to do the treatment. You're going to feel first cooling and then a little bit of heat and some light at every pulse. We tell people to bring your headphones when you come in for this procedure, as the machine is kind of loud and you're there for an hour and a half, that it might be best for you to be listening to your favorite music or listening to a podcast. We also tell people to wear warm clothing, as the machine itself is going to be cooling the skin. And so it kind of cools the room. And so I want you to be comfortable. So just wear, cool, warm clothing, I mean. After your treatment, we are going to clean the face, remove all the marking, and what's going to be noticeable is maybe you're going to be a little red, you might be a little swollen, and that redness and swelling will usually resolve within 24 to 72 hours. I'll tell you, there's some people who say, hey, the next day I kind of looked back to normal, and there's some people whose redness might last about a week, but on average, it's a few days. There is the possibility that in the first treatment or second treatment, you might flare just a little bit with your acne. Don't get discouraged. If this happens, this is normal, and that means the treatment is working. And you can resume your normal activity the next day. So, as we said, the first few hours are going to be red. It resolves within a day or two. Some people, it's going to be back to normal within a week. With this particular laser, because it's going past the surface of the skin down into the oil glands, it doesn't affect the surface of the skin. So you shouldn't expect to be peeling or anything of that sort. The treatments are done once a month for 4 months is usually the package that we recommend. And your best results are going to be 6 months later. And you will have continual results for years. Like whatever change you got with this treatment is yours to keep. Because the way it works is that it's really neutralizing that sebaceous gland. It's making it less hyperactive. It's making it not as responsive to the acne. And so you end up having more of a permanent change. So again, there's a total of 4 treatments that we recommend, 1 month apart. And here are some photos. This is one girl who got it after 3 treatments, significant improvement. She had really bad cystic acne with a lot of redness, bigger and smaller acne bumps. And after 3 treatments, her skin is amazing. You can see that she still has a little bit of redness, but with time that will really go away. Then we have another patient, and this is a patient with a little bit of darker skin. And as you can see, she has gotten amazing results and no issues because of her skin tone. Another one with a lot of acne, cystic acne on the cheeks. And after just a few treatments, really, really good improvement. And she will continue to have these improvements. So let's talk about what the price is for this treatment. So standard price for a package, actually for usually one session, if you're just buying one session, the usual price is $1,000 a session. If you buy a package of 4, we have it at $3,200. But if you attend this webinar, you get an extra 10%. So the package of 4 becomes an amazing deal under $3,000. So it's $2,880. And this is, so if you are going to consider doing this treatment, I recommend booking it and saying that you were as part of the webinar. Another thing that I want to mention is that this treatment is the only Accure laser that we have actually in Texas. And so a lot of people come for us for this treatment. And within the Westlake family, we actually have the laser currently at the Bee Caves location, which is where I work. And so, what do you do next if you're interested? I would recommend booking a cosmetic consultation for this procedure. As this is a cosmetic laser, your insurance does not cover the cosmetic procedure of the laser, but you can get that special price if by attending the webinar today. So I would say book a consultation with me, Dr. Alvarez. The consultations do have a $200 deposit, but just know that that deposit goes to your treatment. So if you end up deciding, I do want to do the Accure laser, we use that $200 goes to your treatment. And when you book the appointment, you can either do it online or you can call in and just say that you want to do an Accure laser consultation and that you attended Dr. Alvarez webinar so you can get that special. The consultation can be done at both of the locations that I work at, which is at downtown location or here at the Westlake Main on Bee Caves Road. And just know that once we've done the consultation, we agree we're going to do the procedure. The laser treatments are done at the Westlake at Bee Caves because that's where the laser is located. Um, all right. So I am now going to go into the Q&A session where we kind of look at some of your questions. I'm just going to kind of log in here and keep putting some of your questions down into the box. And so let's see here. So somebody asked, so would you say I would be less oily in general? I have pretty oily skin. Okay, yeah, so this is a really good question. So because it actually targets your oil gland, it actually will make you less oily. Because people who are really, really oily, that means that your oil glands are hyperactive. And so this treatment is actually going to reduce that. Next question. Can it be done with other treatments? Would I stay on Accutane? Ah, okay. So Accutane, while you're on Accutane, you're actually not supposed to do any laser treatments. And so if you are on Accutane, I would say you want to finish your course of Accutane and then you would consider laser treatments months later. So I would definitely come in as a consultation. That would be an individual question about when we can do it, would we do it? But you don't want to do Accutane and lasers at the same time. Now, if let's say you were on an antibiotic or you were on a topical cream for your acne, that you could actually do while on. You can do your topical cream and do the Accure laser. It's just that Accutane is a separate medication that you cannot do lasers at all. Let's see. Okay, so Um, someone asked, is this suitable for a 12-year-old girl? So most of the studies when it came to the laser was actually done on adults, but it doesn't mean that it cannot be done on someone younger, especially with parental consent. Um, and so just know that it's something that definitely can work on someone that's younger, but I would come in as a consultation so we can assess if you would be an appropriate candidate. Um, so somebody asked, the brochure that I got said that it was 80% lesion reduction um, after 4 treatments and 45 in 1 treatment, but my numbers were a little different. So this number that I actually got, I got it straight from the Cure company. So they actually, that's their most updated one. But I'll tell you that there's it varies, right? So this is on average. Like on average, someone might get 70 or 80%, but I have people who look better than 70 after 3 treatments. And so just know that 70, 80% is on average. Some people might do way better, and some people might do a little less than that. Yeah, so thanks so much. I'm getting a lot of questions. I love this. Okay, so we talked about that one. Can you do your first treatment on the day of the consultation? Unfortunately, we cannot. The consultation, we would have to book it separately because the laser machines are actually booked on separate, like it's booked for a particular patient. And we want to make sure that you are fine to do the laser. And part of the consultation is to make sure that you're not using any medication or there's any reason why you would not be good for the laser. And so we usually do this on separate days. But we always try to work you in as soon as possible. So if you want to do it, you do a consultation and we have availability, we try to get you in with the next week or the following week. Alrighty. Next question. Works on all forms of acne. This is a really good question. So acne all have a component of the sebaceous gland, right? So you have acne because it works on the follicular unit, which has the oil glands. And so it would work on most acne. If you feel like your acne is very different or for some reason, come and talk to me and we can chat about it. But it's meant for all acne. Can the laser be used on the nose? Okay. So yes, it can be used on the nose. Usually, so the handpiece is actually it's quite large, and so you end up just being able to get two pulses. You really can't get into like very tiny little areas because the handpiece is big. So that's why it works on the whole cheek and on the nose. If it's on the sides of the nose, it would work. Um, and for that one, I would definitely come in and let's chat about it to see specifically where on the nose is it that you're trying to target. All right. Next question I see here, long-term side effects. So with long-term side effects, honestly, with any laser, actually, it's not even long-term, but long-term side effects, well, it has helped your sebaceous gland. There aren't really risk of I guess I would say like long-term side effects. This laser is very specific wavelength that's targeting the oil glands. And so with any laser, with the risk of like, having a lot of erythema, a lot of swelling, erythema is redness, so a lot of redness, a lot of swelling. But generally, since it's targeting just the oil gland, it's very rare to have any of those or like to have burning that we sometimes can see as a rare side effect from other lasers. Okay, so what about teenagers? Instead of Accutane, can they do this instead of Accutane? Because Accutane, but it's kind of harsh. I really like this question, and I have this conversation all the time with my patients. When I talk about acne, I explain how like there's all these treatments, right? There's creams, there's pills, there's antibiotics, there's spironolactone, there's Accutane, and then there's the Accure laser. When it comes to acne, we know that acne is something that you're going to have for a long period of time for most people. It starts sometime in puberty and it will last. And there's some genetic environmental factors. For some people, it's a few years. For some people, that's 20 years. But we don't know how long your acne is going to last for. And so most of the treatments, like a lot of the creams that we use and the antibiotics, your acne is only good while you're on it. The different ones are Accutane and Accure laser. These are once you finish a course of the treatment, your acne is going to be more permanently changed. That it's going to be completely different than when you started. That you might not need any medications after doing the Accure laser or the Accutane. Now, I actually have a lot of people who come in for the Accure laser because they're not interested in a pill. They don't want to take Accutane, and that's an individual choice. And that's something that we can discuss as well. If are you interested in that? But Accutane, some people are just worried about potential side effects, and the Accure doesn't carry those same side effects. So it's a laser device, so there's less side effects when it comes to that. Let's see. Next question. What if I have hormonal acne? Does only play a role that okay, so they're asking about hormonal acne. So I always tell people that actually, so when you say hormonal acne, it's probably that yours has a big role, like the hormone part of it has a huge role in your acne, but everybody's acne has a bit of hormonal components to it because 7-year-olds are not getting acne and 90-year-olds is people who are in that puberty stage who have a good amount of hormones. And yes, it would work on you because you have the sebaceous glands, like the acne is working in the area where you have the oil glands. And so the Cure laser will work for you as well. All right, let's see here. How do teens handle this regarding pain level? So they finish a round of isotretinoin in November and acne is back. I'm looking into alternatives. Um, so basically, the laser with all lasers have some amount of discomfort. And I think that it depends on the individual. I think that if they're a little older, they understand that there's going to be some discomfort for this. They understand that and it'll be okay. I have adults who, even with a numbing cream, feel like it's a little bit painful. I'll tell you that what we offer, so numbing is number one, and that's going to help for the majority of the discomfort. If that's not enough, then we offer Pronox, which is laughing gas, and that helps kind of relax and make you feel better. And if that doesn't do it, then we can also do injections of lidocaine into the skin, and that is a last resort. And that works for people who have really low pain tolerance. Um, let's see. Oh, what about darker skin tones? Any risk of pigmentation there? So actually, this laser is completely safe in any skin tone. I've done it in darker people, lighter people, and the really the risk I have not seen pigmentation with this. And so it's not, it's really goes past the skin layer of the skin where you have pigment. It's not targeting pigment, it's targeting the oil gland. And so that risk of pigmentation would be very, very low. Obviously, nothing is zero, but that would be extremely low. I feel pretty safe doing it in darker skin types. Let's see. Would it be helpful for rosacea related acne bumps? So this is an interesting one. Acne and rosacea are cousins to each other. Now, the Accure laser is approved and it's been targeted for acne, but it probably will help people with rosacea as well, especially if you have acne-like bumps in rosacea. It should help as well. Any help or improvement with acne scars? Okay, this is a good question. So this laser does not help with acne scars. Acne scars is a different beast. This goal is to treat the active acne. So what I tell people, when you have active acne, we need to focus on stopping your acne and then we focus on scars. For scars, we did different lasers, microneedling, ablative laser. So it would be a different laser treatment. And it says, if I just have very oily skin but no longer have acne, will I need all 4 sessions? Good question. So there's no studies on this particular question. I'll tell you that it will likely help your oiliness, but we would have to see how many sessions you would need. You're somebody who you might want to do session by session instead of getting the package because everyone's skin is a little different. And so you may need 4 sessions or you might not need as many. Let's see. Next questions. Okay. After the 4 sessions, is it necessary to have more downtime, to have more down the line, to have more down the line, or is it usually one and done? So I'll tell you that most people after 4 sessions are really happy. So, right, we saw that statistics of 70% reduction, and there's some people who even get better. But I'll tell you, there's a few every now and then that need more than that. But so maybe you need 5, 6 sessions. But usually whatever result that you got, like if you got 70% improvement, 80% improvement, that is yours to keep. Um, and so it's rare, but yeah, maybe a person might need 1 or 2 right after. Have you seen this more effective in certain types of acne or skin? And why is it like any guesses on why is it more effective? Okay, so I feel that it's it's really effective. So I find it's the most effective in people who have the bigger bumps. People, it's so if you have like really large pustules, cystic acne, the bigger ones, it actually works really well because there's a lot to target there. People who only have like the little teeny white and black heads, it doesn't really work well if you only have teeny little white heads and black heads. So we can talk about that if you're that person. But it works really well for the average person who has red bumps, pus bumps, cystic bumps, things like that. And the reason there is because the acne bumps that are pustules, that are cyst, they have a really high component of the oil gland. The oil gland is really involved. And so when we target the oil gland, it really reduces your acne. But if you have these little tiny, tiny little like whiteheads and blackheads, the oil glands are not as big, are not that hyperactive. And so that's where it's not as effective. I hope that answered your question. Let's see here. Does this laser age the skin at all? Um, will I look like I'm 80 when I'm 60? So no, the studies do not show this. It shouldn't age your skin. Because what causes aging skin is actually like loss of collagen and elastin, and this laser does not target elastin or collagen. It is targeting the oil gland. So Oh, okay, so somebody asked about AviClear. So this is a good one. So AviClear and the Accure laser are actually the same wavelength. So this is what was amazing in the last few years. Before that, we really didn't have a laser that targeted one of the root causes of acne. We had lasers in the past or like light devices that maybe help with redness or bacteria or but it was never really so targeted to the oil glands. And AviClear is just a different brand, but it's actually similar to the Cure laser. And what I'll tell you is that um, some people will make claims that one is better than the other. Um, in my experience, we have the Cure here. We do not have the AviClear, but the Cure works really well. And so it's similar, I would say. Do you know if the actual laser does the do you know what the actual laser does for the sebaceous gland? Does it kill them? Does it shrink them? Okay, yeah. So what the studies show is that the Accure laser actually makes them smaller. So it's shrinking them. So it's not completely obliterating them, but the idea is that like people who have acne have these like really huge oil glands. And so the goal is that we're making them less active and smaller. I have dry skin. Will that make it worse? So that's a very complex answer because dry skin can be caused by many different reasons. Obviously, oil component is one, but some people just naturally have a different skin and have a drier skin. And so I would say not inherently. You won't necessarily get drier skin because of it. But I think it might be a good one. We talk about it so I can figure out why is it that you have dry skin. Next question. It says, what about sun exposure after the treatment? I always just tell people avoid sun exposure at least for the first few days after the treatment. It's not the laser that there's certain lasers that we are strict about no sun for a week. This one is not this laser, but it just to be safe, just stay away for a few days. Next question. Can you space out the treatments? Like more than a month. Yeah, that is totally fine. We just tell you not to come sooner than a month, but you're able, like if let's say you're really busy, I have patients like this who are traveling, who are like, very busy or going because of work. And so they might be coming in every 6, 7 weeks. So not really every 4 weeks. And that's okay. And there's no harm in that. But you still want to complete your 4 sessions to see the good results. And think this is the last question. Have you ever heard of anyone struggling with dryness after the treatment? I have not. My patients haven't complained of that. And the part of it is that it's not removing all your oral gland. And as I mentioned with the other question, it depends why you might have dry skin, but has not been a complaint that I've seen. Well, guys, I thank you all for coming to this webinar. I have had a great time. You guys have asked so many great questions, and just know that if you're interested in booking a consultation, you can book online, you can book over the phone with Dr. Alvarez at the downtown or Westlake location, and just make sure you tell them that you attended our webinar so that you can get the special. And I look forward to seeing you all in the clinic. Take care.